Hi CAM followers, welcome to another one of our Facebook Lives. Today we're joined by the very lovely Dr. Ronald Corbee, who's joined us all the way from the Netherlands to talk about nutrition. I'm going to pass straight over to you, Ronald, if that's okay, and just tell everyone a little bit about yourself.
Okay, thank you for your introduction. My name is Ron Corbee. I'm a veterinarian, and ever since I was a child, I wanted to become a vet. I went to vet school in Utrecht and then worked in private practice for a while. And then I got the opportunity to become a nutrition specialist. So I went into a training program in Utrecht. I did my externships in Liverpool, in UC Davis, and at Cornell University. And then I finally set the exam in Spain and became a specialist. And then I did my PhD on nutrition and skeletal health in dogs and cats.
So you can see why we wanted to get him on here to talk to us about nutrition. We've got one of the world's experts with us. So I guess we can start straight away with the question of, what are we looking for when we're talking about nutrition in aging pets? So a healthy aging pet, what sort of elements are we looking at to get a good diet?
So if we look at aging pets, there's a lot of things going on as they age. So aging is a gradual process, and one is earlier at a mature age than the other one, so to say. So it varies, and even within the senior group, you also have like the geriatric group, and they all have their different needs. So it's not just one type of food which is the best food for a senior or a geriatric dog or cat. So we know they often develop osteoarthritis, and a lot of studies demonstrated that more than half of the senior dogs and cats actually have problems with osteoarthritis. Mm-hmm. So we're looking for foods that have supplements that are okay for osteoarthritis, and we will come back to that later in this chat. So I will not elaborate too much on that. Another common disease of senior dogs and cats is, of course, renal disease. So there's a lot of debate on protein content of the diet, because we know that high protein content might not be good for the kidney health, especially when these dogs and cats are uremic, so they have high blood levels of the kidney, and then often we want to restrict protein intake. But on the other hand, we want to prevent them from breaking down their own muscle protein. So it's very important not to restrict protein too low, because otherwise we will not meet their requirements and they will lose muscle mass. And that's something which is also occurring in aging animals. And that's something we want to prevent. So it's not only the amount of protein which is important, but also the quality of the protein is very important. And in general, animal-derived protein has a better quality than plant-based protein. So if you are looking for plant-based protein, then you have to go for soy, which has kind of similar amino acid profile, so the little building blocks of protein compared to animal protein. Yeah. And it's difficult to read from a package what is the quality of a protein. So yeah, it's not easy to just look at a pet food label to see what is the best diet for your senior pet. Apart from protein, phosphorus is very important if we regard kidney health. So we know that high phosphorus intake can really progress renal disease. So if we want to slow down progression of renal disease, we want to restrict the phosphorus intake. And that's even more important than reducing protein. And again, here the source is important as well, as we know that the anorganic phosphorus, so the phosphorus which is not derived from bone, but phosphorus which is added to a mixture of food, is more harmful than the phosphorus that comes from bone, because that's already bound to calcium, and that's better balanced out. Another thing which we regard when we look at kidney health in geriatric patients is salt intake, and that could also be important for instance, cardiac health. We know from human health, of course, that it's very important to restrict salt intake because that can elevate blood pressure, and that may worsen kidney disease or cardiac disease. Our dogs and cats luckily are not that sensitive for salt as we are, so they tolerate higher amounts of salt. It doesn't really affect their blood pressure in the same way as it does for us, but we still recommend not to give very salt-rich treats to those dogs and cats.
Okay, so when you're talking about food in general with an older pet, is there a time of day or a regularity that we should be feeding them? Should they be starved? Should we do little and often food? Is there a recommendation on frequency?
So we know that also from people that when you get older, your thirst and your hunger spark to start eat or to start drinking can be lower. So we see that in some dogs and cats as well, that they just forget to eat or forget to drink. So it's important to offer multiple small meals and always have fresh water available to make sure that they get everything in. Especially elderly cats with renal disease, we want them to drink enough water. So if you really want to increase water intake, I prefer to use canned food because then they really consume high amounts of water, way more than they would consume together with dry food and drinking, because often they don't drink if they eat canned food, but that's not a problem. They get more than enough moisture if they get the wet food.
Yeah. And obviously one of the things we talk about a lot on CAM is obesity management. So how do we do that in a way that is sensitive to it being an aging pet?
Yeah, so we see that with increasing age, we first see a tendency of an increase of prevalence of overweight and obesity, and it decreases when they get geriatric. So there's a slight increase and then suddenly a decrease again. So a lot of senior diets are a bit lower in energy because aging animals are less active, have less muscle mass, so they need a bit less of energy. But on the other end, we also see them forgetting to eat, and then of course we need to increase the amount of energy in the food. So it's again not one size fits all. We really have to adapt it to the individual level.
Yes.
But indeed, obesity management is important because obesity can aggravate osteoarthritis, for instance. Weight reduction should go gradually, because if it goes too fast, they also lose muscle mass again, and that's particularly happening in senior patients. So we really have to be careful to gradually reduce the amount of food and see that they gradually lose weight. So we want geriatric dogs and cats, if they are on a weight loss program, to lose between 0.5% and 1% per week of body weight maximum. Yeah.
So nice and steady so that they keep it off, just like we would with us. No crash diets for our doggies then.
Yeah. Crash diets are usually not that successful because you get into a kind of a safe mode. Your body goes into a safe mode, and then you will need even less energy. So even if you go back to a reduced amount of food, then you might even still put weight on because your body is still in safe mode. And you don't want to activate that.
Yeah. Okay. One thing that we've heard a few times from different speakers is the benefits of fasting. So not to feed too regularly. We on CAM talk about feeding quite often because of enrichment for the pet. Is there a benefit to fasting so in between meals for an obese pet, or not so much, or do we not have the evidence for that yet?
Yeah, that's a difficult question to answer. If we talk about, for instance, cognitive decline, there is some evidence that if you really get in a ketogenic state, and that's especially known in people, and also when you have epilepsy, if you get in a ketogenic state, your brain will adapt to different fuel source, so they don't use the sugars anymore. And if your brain consumes a lot of sugars, and that's especially happening if you get constant meals over daytime, and especially if there's a lot of sugar in there, of course, or carbohydrates, you get more reactive oxygen species. And these are molecules that cause inflammation. So they cause an inflammatory response within the brain, which might aggravate cognitive decline or may worsen epilepsy. Whereas if they switch to ketone bodies, which are formed during fasting, then you can see that those reactions are not taking place. So you can play a little bit with that, but it's very difficult, especially for dogs, to get them in a ketotic state. So with fasting, you will not even achieve that. So if you want to get them in a ketotic state, you have to give them medium chain triglycerides. So these are fats derived from, for instance, coconut oil or from insect oil. And these fatty acids are directly converted when they are absorbed in the liver into those ketone bodies, and they are a fuel substrate for the brain. So that is more effective, and that is something you can see in some senior diets where they add MCT oil, which are the medium chain triglycerides, to get them in a sort of fasting state while you are still feeding them. So if you want to have those benefits, I would go for that. I would not go for fasting per se. No.
Yeah. That's good news, because we like to use a lot of nice enrichment games and things with our arthritic dogs who can't maybe go out on the walks they used to want to go on. So it's nice to know that we're not doing any harm by doing that, as long as we're managing the amount of food they're having.
Yeah, that's very important. Yeah.
So moving on to that, so the arthritic and joint disease, what are we looking for in terms of a diet for those type of dogs?
So what is very important if we talk about osteoarthritis is weight management. So these animals should not gain weight, preferably, especially if they are already a bit overweight or have a tendency to become overweight. Mm-hmm. So if they are overweight, we have to start a weight loss program. That's step number one, because the inflammatory response, which is happening when adipose tissue is growing, so if you accumulate fat, will also worsen the inflammation which is present during osteoarthritis. So we have to stop that process by just stopping the accumulation of fat. So that's an important one. Another way to modify the inflammatory response is with long-chain polyunsaturated omega-3 fatty acids. Mm-hmm. And those are fatty acids that are derived from fatty fish, for instance, or from algae. You also have like vegan sources for that. But it comes down to the fatty acids EPA and DHA. That's a shortage of very complicated names. Yeah. But these fatty acids really have a sort of anti-inflammatory reaction. So they slow down the acute reaction and they kind of resolve an inflammatory response within the joint. Yeah. And these fatty acids in scientific studies have really proven to be effective to reduce pain and to reduce the inflammatory response, but also to reduce the breakdown of cartilage, which is part of the pathophysiology in osteoarthritis. So that's one. If we then talk about the cartilage and the quality of the cartilage consists of collagen and of glycosaminoglycans. And that's another difficult term, but it's like sugar structures, sugar and protein, which form a sort of a sponge. And the fibers are collagen, they hold the sponge, but the rest of the sponge is filled with these glycosaminoglycans. Yeah. And it works like a sponge, so it can absorb forces that are put on the joint. So it withstands those forces without damaging the underlying bone. So it's a protective layer, and if you want to slow down the breakdown, because that's what's happening with osteoarthritis, you can give substrates for the glycosaminoglycans. So, for instance, glucosamine and chondroitin sulfate, which are components that are often used in osteoarthritis diets and also in supplements for people. I know even in some countries it's even considered a drug, but in most countries it's still regarded as a nutritional supplement. But these are building blocks of cartilage, and you can give them as a repair or as a substrate for the cartilage degrading enzymes. Yeah. So you slow down the progression of the breakdown of cartilage. The downside is that the cartilage which has been damaged just because of overstress on the joints, or because the cartilage gets older and more brittle, so that it more easily gets disrupted. This repair cartilage is always of less quality compared to what it was. So at a certain point, this layer will get thinner and thinner. And this is a process we cannot stop, but we want to give substrates or foods that try to slow down this response. Yeah. If we look at those components, there's not really much evidence for it, despite the fact that a lot of people are using it, both for themselves and for their pets. So there's some contradictory evidence, but it seems that it's doing something. If you look at what we call meta-analysis, so if you combine all the studies together and then look at the good quality studies, so that evaluated on the long term, at the right dosage, proper outcome measures they use to evaluate the quality of the effect, we can see that there's a little effect. Yeah. The effect of omega-3 from the studies we have is much bigger than from glucosamine and chondroitin. Yeah. And you can also give collagen, which is another building block, and you have different forms of collagen. So you can give it as a building block, which can be hydrolyzed collagen, or beta-glucans, but you can also give what we call undenatured type 2 collagen. And there's a patented complex which they derive from chicken sternum, actually, so from a bone from the chicken. And this type of collagen is the type of collagen that gets damaged and gets into the joint when there is damage of the cartilage. And that's where your immune response reacts to. So that's causing this enormous inflammatory burst. And if you give that type of collagen in very low dosages, orally, so in the food or as a supplement, you train the immune system, because there's a large immune system in your gut. You train the immune system that it's normal that there is some of this cartilage exposed to the immune system. So then the reaction will not be similar as when it will do when there is a damage of cartilage. So we take advantage of that, and that's actually a kind of immune therapy which you can do with a food substance. So that's quite cool. We see positive results from that, but almost all of these studies were done by the same group, which was sponsored by the one who have the patent. So we're still a bit in doubt whether this is really non-biased and really good research, but we still think it's very promising if we look at those results. And there's so many other things you can give as a supplement. So now there's the cannabis oil, which has gained interest because it's a painful condition and we want to do something about the pain, and also about the inflammatory response, which might also be a bit modulated by cannabis oil. There's also a lot of antioxidants, and a very large group is polyphenols, which is also a component of this cannabis oil, actually. Polyphenols in recent human studies have really showed promising results. And they actually say it's even better to give polyphenols instead of anti-inflammatory drugs, because it really helps cartilage to regain its normal strength and normal capacity.
Wow.
We know this takes a very long time, but yeah, if you look at the results they saw, even in preventative studies where they gave this to sports people that do extreme sports, and they evaluated their cartilage, which they could measure with radiography, and they saw that the sporters that had taken those supplements for 2 years had a bigger layer of cartilage compared to the ones that didn't get it and did the same sports. So this is really something which we'll hear much more about in the future, I guess.
Very exciting. It's nice to hear of more things that can be done to help with arthritis, because it's such a terrible disease and so many suffer with it, humans and pets.
Yeah.
So in terms of when we should give a supplement, is it worth giving it as a preventative? Do we have any evidence to say that if you start it as they're younger, it's better, or is it best to wait till they start to show symptoms?
Yeah, well, if I look at the human trial they did in the sportsmen, I would really say there is a huge benefit of giving it as a preventative substance, so to say. But for dogs and cats, we frankly don't know. So we didn't do those trials. And to really do those trials, you have to have like standardized programs. And there's a lot of bias when you do that in pets.
Yeah.
So they do things differently. They don't always have the same food. They sneak outside and do things. They get sick. So it's really difficult to have a standardized group and follow it for a very long time frame to really demonstrate that this gives health benefits. But I know there are foods on the market for growing Labradors, for instance, where they say, well, they all get arthritis when they get old. So better start feeding like glucosamine and omega-3 fatty acids already when they are young. Yeah. And it's not harmful, so you can do it. But the question is, do we really have the benefit in the end? And I frankly don't know from scientific evidence. But there is, from humans, already a little bit of evidence that if you combine strenuous exercise with those supplements, that your cartilage layer will be thicker if you take that as a preventative measure. Yeah.
Brilliant. It's one of those questions you always wonder as a vet, especially as me, like a GP vet, where, for example, a very active Labrador, I might think, or are you going to get arthritis when you're older? When do I recommend joint supplements? So it's good to know you're not going to do any harm and potentially have benefits. It's just the cost for the owner more than anything that's the negative, I suppose.
Yeah, that's correct. And if owners have limitations on costs, I would always say, as a scientist, I would go for the supplements that have the highest level of evidence. So in dogs and cats, that's for now the omega-3 fatty acids. Yeah. But all the other supplements have their role to play, so to say. And I don't know how big that role is in osteoarthritis in dogs and cats, because we need to do more studies.
Yeah. So another popular, I'm slightly changing course here, another popular thing at the moment is grain-free diets. And I wondered if you minded talking about why they've become popular and why we've sort of turned to those, or whether we should turn to those.
Yeah, grain-free is really a hype. Grains are banned for several reasons, which mostly come from human medicine. Mm-hmm. So we know that people have celiac disease. They cannot tolerate grains really well. Some people just ban bread from their regular eating pattern because they think that will that is the cause of all the problems, and it's mostly with gastrointestinal problems or with skin problems. Mm-hmm. So if our pet has some gastrointestinal or skin problems, we immediately think, oh, that's similar, and why should dogs and cats eat grain anyway? They don't eat that in nature, so we better just not feed them this, and they might get better. And that's the stories you read on the internet as well. If you switch to grain-free diet or from kibbles to, for instance, homemade food or raw food, that you see a big improvement in gut health and in skin and coat condition. And they say the grains are the ones to blame for all the problems that were there in the past. So that's why they became popular, actually.
Yeah.
But we don't know whether that's really true.
Okay. So, because I understand that we've noted some links between cardiac diseases and grain-free diets. So, when we're reaching for a diet for our pet, should we be looking for grain-free or not?
Well, grain is often blamed as being a filler, something the pets don't need. But if they are heat-treated, pets can take advantage of grains as well. So they have a lot of benefits. They contain certain amino acids, which are essential for dogs and cats as well. They can also get it from other types of food, but they can get it from grain. There's vitamins. It's a source of fiber. So there's a lot of good stuff within the grains as well. And if you leave grain out of a kibble, then you have to be creative to design a new kibble which still has a structure or component, because that's important if you want to produce a kibble. And that's where things go wrong, because then we start replacing grain for instance, legumes, and those products, peas and lentils, they have anti-nutritional factors. And these are factors within the food that affect the absorption of other food components. So, for instance, the absorption of lysine and cysteine, the sulfur-containing amino acids, decreases if you put in a lot of lentils and peas. And that's why we think there is an association with dilated cardiomyopathy and the grain-free diets. Because if you give those diets, it might be that there is enough taurine and carnitine in there, which is needed to prevent dilated cardiomyopathy from occurring. And we know that the deficiency in those can cause dilatative cardiomyopathy. But we don't know if this is really a cause-effect relationship, but that's a possible explanation, so that the absorption of the building blocks of carnitine and taurine are decreased because of the legumes we use instead of grain. But we see it most often in dogs of certain breeds that are already predisposed for developing DCM. So, yeah, it's still a bit debatable. And I know a lot of people think that grains are a common allergen for dogs and cats. But if we look at the research, then chicken and beef are much more common causes of allergies in dogs and cats. So if you want to prevent allergies, I would rather leave beef and chicken out rather than taking grains out for that particular reason. But it occurs, but it's only a very small group of dogs and cats that are really allergic to grains. So yeah, for those dogs and cats, there's a lot of products on the market currently. And the number of cases of dilated cardiomyopathy are quite low. So there's a lot of pets eating those diets, and there's only a very small portion of them that really get sick. So I think we have to be cautious to immediately pinpoint at the food. Yes. Because that's what people tend to do, just blame the food, blame the pet food company. But yeah, they have a lot of smart people working there. And they know about this, so they find ways to overcome this from happening, because they don't want our pets to become sick. Of course, so. It's
not a good sales point for the company if they're creating poorly pets, is it?
Yeah.
So another question that crops up a lot, we have a owner advice forum, and there are some dogs who are reactive to non-steroidal anti-inflammatory drugs, and they end up with an upset tummy, vomiting and diarrhea. So what's the best way to manage a pet that's unfortunately become poorly because of secondary effects to an NSAID?
So these NSAIDs are very nice to use because they're very effective in both combating inflammation and the pain reaction. So we use them a lot as veterinarians. And you have cheap ones and you have expensive ones. And usually the more expensive ones are the more selective ones. So they tend to have a strong cure effect and don't have much side effects. So one of the options can be to change from one NSAID to another one to see if the reactions are milder or disappear. But common side effects of the NSAIDs are, of course, indeed gastrointestinal problems. And it can even go to severe bleeding from the gastrointestinal tract. So if that's happening, I say you should immediately stop giving the NSAID and trying to find something else. So we can also switch from NSAIDs to other pain medication or to other anti-inflammatory medication. So there's options there. If we look from a food perspective, or if you give the NSAIDs because of osteoarthritis, we know that the omega-3 fatty acids will have what we call a sparing effect. So you can reduce the amount of NSAIDs and they are still effective because they work with a kind of similar mechanism as the omega-3 fatty acids. So there's ways to overcome part of the problems with supplements. Yeah. And other aspects in general, if we talk about gastrointestinal upset, is of course giving a highly digestible food, so something which tends to have a bit higher energy content, lower fiber content, which is easier to digest. So the gastrointestinal system doesn't have to work that hard anymore. And that might also prevent problems from occurring.
Yeah. And obviously, once they've got very sick, they need to go to the vets and have fluids and medications and things like that. But it's trying to manage patients and I guess following the instructions that are on the label. So if it says give with food, make sure you've got a nice big full tummy before you give medication and all those sorts of things as well.
Yeah, it's also recommended for people to not take it when you are in a fasted state, but to take it with food to lower the side effects. Yes.
And then I guess my last question that I want to go on to is we constantly go on about this thing called evidence-based medicine. And we want to know that we're giving the right things for our pets, that we've got scientific evidence for. Where can owners go and what can owners do to find out what sort of food they should be using or what evidence we've got for different foods?
So there's different platforms where you can find the information as a pet owner. I know, for instance, in Great Britain, the PFMA has some sheets for clients where they get information about pet food. And the PFMA is associated with FEDIAF, which is the European Associated for Pet Food Manufacturers. But on the other hand, you could say that's biased because that's something that companies want you to read, but you have to keep in mind that within PFMA and also within FEDIAF, they have a scientific advisory board. So they have independent people working at universities, not working and not being paid by the industry, that give valuable input in those fact sheets, and we comment on them. So if we think they are incorrect, we immediately correct the pet food industry that they should give proper information. Mm-hmm. So you can find information there. What I often refer my students to and veterinarians to is the nutrition toolkit of the World Small Animal Veterinary Association. They have a nutrition toolkit, and they also have a paragraph directly for pet owners to find their information. So this is a veterinary association giving some guidelines on proper food, how you should feed your animal, and where you can find proper information on the internet about food. You can always contact nutritionists. I'm one of them. We are with about 40 active specialists in nutrition in Europe. In the US, they have about 75, I think, active specialists in nutrition. They all have their websites. You can find them and contact them if you really want a specific recommendation for your pet. But also if you have more general questions, they often offer nutrition service where you can ask questions. For instance, I have got a vet nurse that's also very well trained in nutrition, and she can answer a lot of questions as well. Mm-hmm. And hopefully vets will get more training in nutrition.
Yeah.
And are able to answer a lot of questions. And I know me and a lot of my colleagues are really into giving postgraduate education and improving also nutrition education in vet schools, and try to spread it, because not every vet school has a nutrition specialist, but we offer like webinars and online information to share to all the vets, and try to have a low threshold and be available for everyone who is in need of our service.
Yes, thank you. We do. It's one of the areas that you think it's sometimes just missed. We know about prescription diets, but sometimes knowing about the normal diets isn't a big area of expertise. I know myself, that's one of the things I worry about, sort of recommending a certain food, because I don't always know that is necessarily the right one for an individual. So it's always nice to know that there are specialists out there for people to ask for their individual pet, because they're just like us. They are all different and they all require different things. And when you take into account disease statuses and other things going on, it can become quite complex. So we're very lucky to have people like you out there who know lots of things about food that we can come and ask questions to. Sorry, carry on.
Yeah, it's especially becomes more confusing to veterinarians in elderly patients, because they have combinations of disease, like they have an adverse reaction to food, renal disease and osteoarthritis, and what should I do? So there's a trend in the pet food industry to also already overcome that by making these combination type diets, but still there's a lot of questions that are unanswered, or there is a big gray area in which you need some guidance. So that's what we are out there for. Yeah. Brilliant.
That's all my questions for today. I'm sure we'll be bothering you again to come and join us and answer some more questions for us in the future, if that's okay. But thank you very much for your time today.
Okay, you're welcome. Thank you for the invitation.
And thank you everybody for joining us and watching tonight.